Hello and welcome to today's video from Finity Therapy. So in today's video, I'm going to talk about something that I think perhaps doesn't get enough attention and is really important for people to know about. And when I say people, I mean potential clients of the field of mental health. Now, the reason why this is important is because there are so many different types of professionals that one can come across in the field of mental health. They all have different backgrounds, different training levels, different accreditations, different things they do, but these distinctions aren't known to people generally. And even people who are qualified in the field can be quite confused about what each other does, or, as in we don't really know necessarily the level of difference, the variation that exists between us. So I thought what I'd do is I'd outline this for everyone, and hopefully when you're seeking mental health support for yourself or anyone else, you can be a little bit more well informed to understand if your needs can be met by that particular person with that particular title. So what are the titles that I'm going to talk about? Well, there's a few main titles that are quite common, so I'm going to go over those ones in this video. And these are all for the UK, by the way. Everything I talk about is UK based and oriented. So the titles are Psychological Wellbeing Practitioner, Counsellor, Psychologist, Psychiatrist, as well as Psychotherapist, and then I'm going to talk about some other specific types of psychologists as well. And not quite in that order, but that's what I'll be talking about. Let's start with the Psychological Wellbeing Practitioner. What is a Psychological Wellbeing Practitioner? I'll refer to them as PWPs now, because that's how they refer to themselves as well. A PWP is someone who normally will work in the National Health Service of the UK, the NHS. They normally offer short-term or time-limit guided self-help. That's what it is. It's not counselling, it's not psychotherapy, it's not talking therapy, it's guided self-help. So what is a PWP? They are essentially a coach who will guide and coach people in up to 6 sessions normally, and their work is based in the principles of cognitive behavioral therapy. So just so you know, it's not CBT proper, but it's based on the principles of CBT, and the idea is that within the time that you have with the PWP, you learn the tools and the techniques to help yourself and to manage the difficulties that you might be going through. The PWP is normally either low intensity, which means they will work with individuals who experience mild to moderate symptoms of anxiety or depression, or they could be high intensity, which means they work with individuals who experience moderate to severe symptoms of anxiety or depression. When you go to see a PWP, just remember what they offer, remember the length of time that they're able to offer, so that could be 6 sessions. Sometimes this can be extended, and just remember the type of help it is. It's guided self-help based on the principles of CBT. The next one I'm going to talk about is counsellor. So what is a counsellor? Now, there's a difference between the title counsellor and the act of counselling. And the reason I say that is because not everyone, of course, on this list that I'm going to talk about today uses the title counsellor. However, everyone on the list, aside from the PWP, can do counselling. That's the difference. First of all. So what is a counsellor? A counsellor offers usually unstructured sessions in the sense that they're not necessarily going to focus on a particular strategy or a type of technique. They're normally open-ended. They will offer you sessions that allow you to come, take some time, some space without judgment, and offering you empathy and the ability to really make sense of your difficulties and to help you work through the feelings that you're experiencing, and to understand, to gain understanding of the situation, of yourself perhaps, and perhaps to also help you to move in a direction that you want to go in. So that's what it is, and that's what's being offered. Now, in terms of accreditation, with all of the ones I'm going to mention, actually, you will normally have some sort of accreditation, and that means that could be that they're governed by the British Psychological Society, or the British Association for Counselling and Psychotherapy, or some other body, some other entity. And what these accreditations mean is that they are a member of this organisation, so they're on their register, and that they abide by their ethical codes of conduct, and that their work is governed by this. So it's a really good seal of approval if you see this type of accreditation on any of these people that I've mentioned or will mention. In terms of training, it's important really to know what the background is of a counsellor. And the reason I say this is because there is such variation in level of training when it comes to counsellors. You might have counsellors who are trained up to, say, level 3, 4, 5, etc. Or you might have people who have a degree of some description, so that's level 6. And then there are going to be counsellors who might have postgraduate qualifications as well. So it's important to check in with that so that you know whether the person that you are going to who uses this title is able to support you, or at least you feel that they're able to support you. So that's just something I would highlight, because the title of counsellor has such diversity and it's not a protected title by law. The next one I'm going to mention is the psychologist. So what is a psychologist? A psychologist, or let's say, what is psychology? Psychology is the scientific study of the human mind and behavior. There's so many different offshoots, different domains to consider in the broad area of psychology. So let's talk about this then. You can have psychologists who are applied in some sort of specialist area, because it is broad. So, for example, you might have counselling psychologist, clinical psychologist, sports psychologist, etc. And then you have the research-oriented side of psychology. So these are going to be the researchers who want to advance society's knowledge in a certain area of psychology. Psychologist, the title, is normally conferred to people who have a degree in psychology. So remember, that's level 6. That's a degree, a bachelor's degree in psychology. This also, however, is not a protected title. So anyone can actually misappropriate the title psychologist and use it. You might not even have a degree in the area, and this is the worrying thing. Now, if someone is talking about being a specialist in a particular part of psychology, so for example, if they're calling themselves a counselling psychologist or a clinical psychologist, those are protected titles, which I'm going to come on to in a moment. But if they're using other titles like child psychologist, business psychologist, neuropsychologist, or just psychologist, these are not protected titles. So it is important to do your due diligence. As I said with counsellors, just check what the background, the training is for that individual. Do they have specialist qualifications that make them able to help and support in that area as they claim to? Always check in with those sorts of things. I mean, I would say that with everyone that you work with anyway. No matter what they do, what their title is, it's good to do your research to understand whether they can help you. Now, what do psychologists offer if they say working in a particular area? So if they're working to counsel, if they're working in a clinical setting, what kinds of things would they offer? Now, a psychologist will normally be, if they are applied, they will normally specialize in more than one psychological approach. That means that they might be trained in, say, CBT, but they might also have working knowledge of other psychological approaches like psychoanalysis or existential psychotherapy. So they can be what's known as integrative, so they're integrating. Again, counselors can be the same, and so can the other psychologists that I'll come to as well. So there is that kind of overlap in terms of what's being offered. Again, another reason to check what the background and training and competence is of the professional that you're seeking out. Some psychologists are not going to be integrative. Some of them will actually be purists. So that means there might be a psychoanalyst. That's what they offer you. There might be a CBT practitioner. That's what they offer you. And of course, they can still use the title of psychologist. The other thing to know is that the sessions are normally up to 50 minutes. They normally will be on a weekly basis usually, but sometimes that can vary depending on the client as well. So that's a psychologist. Now, the next one I'm going to talk about is a specific type of psychologist. And there's a reason to mention this, because these titles are protected by the Health and Care Professions Council. The HCPC, they protect titles. That means that the titles that they protect must have a certain level, a minimum level of training in order to be able to use those titles. So this is level 8 now. We're talking about doctoral level. So the counselling psychologist is one such title, as well as the clinical psychologist and the registered psychologist, the practitioner psychologist. All of those types of titles are protected by the HCPC. So if you have someone with those titles, you can have a bit of an understanding about the level of training that they have. Again, they will do similar thing to what the psychologist might do as well. Integrative, having working knowledge of more than one approach, for example. They might specialize in a particular area because they will have had to do some extensive research in a particular area of psychology. So for example, they might be interested in attachment, and that might be their specialism, and they might be an expert in that area, for example. So now I'm going to talk about the psychiatrist. And the psychiatrist is a little bit different to everybody else on this list, because the psychiatrist is medically trained as well. So that means they can offer medical examinations, they can prescribe medications, and then they also specialize in psychiatry, which is the study of mental health disorders. But they don't just study mental health disorders, they actually invent mental health disorders. And what I mean by invent is they are the ones who do the research, and they conceptualize and put into their Bible, as it's called, the Diagnostic and Statistical Manual, which is the Psychiatry Bible. They actually add disorders into there. And so the amount of disorders that we have now has grown exponentially. So, it wasn't as much way back in the DSM-1, but now that we're at the DSM-5 edition, we're coming up to, I believe, up to 300 now. So think around 270 something up to 300 somewhere. That's how many disorders are in the DSM-5. So the other thing I would say about these is that at one point, some editions ago, the DSM had homosexuality as a mental health disorder. So it's really quite a worrying thing then, isn't it, to think about how something can be classified in that way, even though it's not a disorder. This is why it's important to take some things with a pinch of salt, and always to be open to the whole person and what they are coming with, and not just label them with a particular diagnostic label that they might have. But it's also important to realize that these diagnoses, these mental health disorders as they're called, can be quite helpful to individuals as well. They can help a person to understand what they're going through, what they're experiencing, to feel like they're being understood a little bit more, and also to access the right support. And that could be medication with or without psychotherapy as well. So it's good to take a balanced view, I think, on psychiatry. So those are the different ones. And then we have psychotherapists. So what is a psychotherapist? Everyone on this that I've mentioned so far could be a psychotherapist other than a PWP. But they have to meet certain criteria to do this, to call themselves a psychotherapist. So if you're a counsellor, a psychologist, a registered psychologist, a psychiatrist, you can be a psychotherapist as well, as long as what you offer is a talking therapy that's long-term. So you see people in a long-term, open-ended type of way, and that what you offer is somewhat intensive. So that means that you will see the client at least once a week, if not more, and that's psychotherapy. So if you do that, any one of these professions can be psychotherapists as well. So I hope now that you feel a little bit more well-informed about all of these professionals, what we offer, what the training is about, whether the title is protected or not, how we work. Hopefully you have a bit more information about that. You know what to look out for. So when you're seeking support, do check titles, check what they mean. Check out our blog, which is associated with this video, which will have all the information with a bit more detail, and just know what you're going in for. And also feel able to ask the questions. Like I said, there's a lot of range when it comes to experience and training, so it's important to know whether you feel that that person can support you and your needs. Thank you for watching, and I'll see you again soon. Oh, and do subscribe if you want to see us again.